a small biopsy, which is just taking a little piece of skin, maybe putting one stitch, and that gives us a lot of information in order to treat the patient.
Now, there was a headline recently about a cancer drug that had a side effect of getting people to grow more hair. What's the story there?
Right, so there is a medication that's out there. It's called Ruxo. It's in the class of medications, which is an enzyme inhibitor. And they found that that medication can actually help to treat certain bone marrow malignancies and other inflammatory conditions. They've also found in the lab that it's also able to treat hair loss, specifically alopecia areata, which is an autoimmune type of hair loss and affects up to 2% of patients.
But for folks watching right now, if someone came to your office, if I came to your office,
Yes.
and I had this problem, what would you give to me most common? What might work for the average viewer right now?
Well, most common, I would use minoxidil, which is an over-the-counter solution. For women, the percentage is 2%. However, we found that a 5% solution, which is generally for men, has been more effective in regrowing hair, thickening hair, and allowing hair to grow longer.
So treat yourself like a man would. Take the big boy minoxidil. Why don't we normally recommend women take that dose?
Well, the thing is that it may irritate their scalp a little bit more. It may cause a little bit more inflammation by using the higher percentage.
So there are women all over the country right now who could take the man's version of minoxidil, a little topical steroid if they need it from the over-the-counter as well, and get results.
They definitely can.
Let me explain this to you. This is such important news for a lot of folks. Let me show why this is so exciting to me. Now, a lot of women get what is called female pattern balding, where you start to get a thinning of your hairline and in the part especially. What's going on in there? You have the same number of hairs, but the actual hairs are getting thinner. That's the problem, and you get inflammation. Now, how do you deal with that? You drop two solutions. You put a little steroid on top to deal with the inflammation, the irritation of the hair. Then you drop another compound like the minoxidil with the male dose of it, and that sinks